Hello everyone. So the next topic which we will be discussing here is about the thyroid gland. So thyroid gland, it is a part of the endocrine system which produces the thyroid hormones that are important for the metabolic health. Now we will be discussing each of these sections, like where is the thyroid gland located, what do the thyroid gland do, what are the main disorders of the thyroid gland. So we will be discussing all these things in these slides. So let's start with the introduction first, that what is thyroid gland. So thyroid gland, it is a part of the endocrine system that produces the thyroid hormones and that are very important for the metabolic health. So it is a ductless endocrine gland, and it is where it is situated. It is situated in the interior and front portion of the neck. Also, it is considered as the largest endocrine gland. What is the average weight of this gland? The average weight consists of about 25 to 30 grams. So this particular gland has two lobes on either sides of the trachea. So with each lobe measuring about 4 to 6 centimeters in length and 1.3 to 1.8 centimeter in width. So this is the length and width of the each lobe of the thyroid gland. Now, so this is a diagrammatic representation that how a thyroid gland looks like. So thyroid gland, what is the location of the thyroid gland? Thyroid gland is located at the front of the, where it is located? It is located at the front of the neck, just below the Adam's apple. So it is located just below the Adam's apple. It is a butterfly shape. It is a butterfly shape. So the thyroid gland which you are seeing is a butterfly shape which consists of two lobes on either side of the windpipe. So there is a trachea. So trachea, or you can also call it as a windpipe. So there are two lobes that are present on each side of the windpipe. So a normal thyroid gland is not usually outwardly visible or able to be felt if finger pressure is applied to the neck. So if you apply the finger on your neck, you will not be able to feel the thyroid gland. So this is what is a thyroid gland. Now, what does the thyroid gland do? So what are the main functions of the thyroid gland? First of all, the thyroid gland, it produces or it secretes two hormones. What are the two hormones here? It is the T3 hormone and the T4 hormone. So these are the two hormones which are being produced by the thyroid gland. So both these hormones, they play a very important role and they affect most or every part of the tissues in the body. The thyroid gland produces hormones that regulate the body's metabolic rate. So what are the hormones here? It is the T3 and the T4 hormones that regulate the body's metabolic rate, controlling heart, muscle, and digestive functions, brain development, and bone maintenance as well. So its correct functioning depends on a good supply of iodine from the diet. So the cells which are producing the thyroid hormone, they are very specialized in extracting and absorbing the iodine from the blood, and it incorporate it into the thyroid hormones. So this is the overall functioning of the thyroid gland. Now let's talk about the hormones, which is the T3 and the T4, which is being produced by the thyroid gland. So let's talk it about in detail. So thyroid gland produces thyroxine, which is also known as the T4 hormone. It is relatively inactive prohormone. So what is it? It is an inactive prohormone. So the highly active hormone is the T3 hormone. So this T3 hormone is very active. That was inactive, but this is active hormone. So collectively, both the T3 and T4 are referred to as the thyroid hormones. So the thyroid gland produces just 20%, so it produces 20% of the active T3 gland, but it produces 80% of the T4 gland. So the inactive hormone is produced in a much larger amount as compared to the T3, which is an active hormone. So once secreted by the thyroid, there are specific enzymes in other tissues like the liver or kidney that may transform T4 into the active hormone, that is the T3. So in addition, there are other hormones also which are producing cell within the thyroid gland, that is called the C cells. So these cells produce, what they produce is calcitonin. So what they produce is, they produce the calcitonin, which plays a role in regulating calcium and phosphate levels in the blood. So which is important for your bone health and the maintenance. So these are the overall functions of the thyroid hormones, as well as some of the important functions of thyroid gland as well. Now, I have already discussed this part, which was in the diagram itself, that it is located in the interior neck between the C5 and T1 vertebrae. So it consists of two lobes and it is a butterfly shape. So there is a trachea and there are two lobes on either sides of the windpipe. And the parathyroid glands are present on their posterior surface. So this is what is the location of the thyroid gland. Now, who all are affected by the thyroid diseases? So now we will be talking about the diseases. So on a worldwide scale, so if I have to see the reports according to the worldwide scale, then there are about 200 million people that have some form of the thyroid disease. So people of all ages and races can get the thyroid disease. But women's, they are about 5 to 8 times more likely to have the thyroid disease as compared to men. So there is a dysfunctioning of thyroid gland in more in women as compared to the men. Now, what are the possible symptoms of the thyroid? So the possible symptoms are nervousness, poor concentration and knowledge retention, change in the menstrual cycle, increased heart rate, muscle aches, weight gain, and there is a high level of cholesterol also. So these are some of the symptoms of the thyroid. Now, some of the disorders of the thyroid. So the disorders will include the goiter, thyroid cancer, hyperthyroidism, and hypothyroidism. So we will be discussing each of these disorders in detail. So first question is that what may lead to these problems of the thyroid disorders? So these problems might be due to the excessive secretion of the hormones, unusual growth of the gland, there can be malignant lumps, etc. Also, scientists have theorized that a relationship between stress, there is a relationship between stress and thyroid health also. So the scientists have given this term also. So some of the main common thyroid problems are this. So let's discuss the goiter first. So goiter, it is an excessive enlargement of the thyroid gland, often obstructing the esophagus or other organs in the neck and chest by causing difficulty to eat and breathe. So this is what the goiter is. Next comes is the thyroid cancer. So it is a very common form of cancer. However, the chances of survival for the thyroid patient is quite high as compared to other forms of the cancer. So if the person is having the thyroid cancer, it may not lead to death, but the chances of survival are very high. So there are mainly four types of thyroid cancer: papillary thyroid cancer, follicular thyroid cancer, medullary cancer, and the anaplastic thyroid cancer. So these are the four types of the thyroid cancer. Next is about the hyperthyroidism. So this condition is caused when the thyroid glands they produces excessively the thyroid hormones called the thyroxine. So if the thyroid gland produces excessively the T4 hormone, then this is the hyperthyroidism. And the symptoms will include the change in appetite, unexpected weight loss. So there will be an unexpected weight loss. The person will be very slim in this case, hyperthyroidism. There is a insomnia, fatigue, irritability, there's a frequent urination, then there is increased sweating, and heat tolerance is also there in case of the hyperthyroidism. The next is about the hypothyroidism, so which means there is a less secretion of the thyroid hormones by the thyroid gland. So in this, the person will become obese, or you can say the person will gain a lot of weight. So it is very common problem and it often stays undetected for years. So it will stay undetected for years. And one of the main reasons that triggers the hyperthyroidism is an autoimmune disease. And this autoimmune disease is the Hashimoto's disease. So what is happening in this condition? In this particular condition, the antibodies they are produced by the body attack that the thyroid gland, and it may result in the glands which is producing very fewer amount of hormones. So this is the condition of hypothyroidism. So this was all about it. If now I talk about the treatment of the thyroid, then the most common treatment that is available for thyroid problems, for example, it can be like hyperthyroidism. So in this particular condition, if I talk about hyperthyroidism, is to replace thyroxine with other synthetic man-made hormones called the levothyroxine, and it is an injectable and oral medication that return the balance in the thyroid glands. So patients will experience a reduction in the symptom of hyperthyroidism in a few or the post medication. So this is the treatment of the hyperthyroidism, where a person is injected the man-made hormone, or they can take a oral medicines also to replace that thyroid gland, that was the T4 hormone. So the cancer in the thyroid gland could be treated quite successfully with radiations. So I have already told you that the thyroid cancer, they have the in they there is a higher chance that there will be a survival of the patient. So it could be treated quite successfully with radiation. So thyroid cancer could be difficult to diagnose sometimes because it does not show signs or symptoms. There is a periodic checkup which has been essential for preventing such diseases from taking the root. So this was all about the thyroid. This was all about the thyroid glands, the thyroid hormones, the disorders of the thyroid glands as well. So these are some of the references.